we might finish those questions there because I can see that our guest speakers have arrived. So, and speaking of teaching, actually Brian Healy, who's joining us, and his partner Karen Healy, Brian himself was a teacher, weren't you, Brian, at one point?
I was, with TAFE, yeah, TAFE teacher.
Yes. So I'm going to hand over the floor now to Brian. Brian has been coming and talking to medical students now for quite a few years, I think.
How many?
3 or 4.
3 or 4.
4 years. Yep.
Yeah.
So, yes, so Brian, I will hand over to you. You've got 100 students here, and Brian's going to talk about his experiences. And the students have watched the video with Vicky, so they know a little bit about the background of ACV Guards, but Brian is a member of ACV Guards as well. But I will hand over and let you take the floor, Brian.
All right, thank you, Myra. Good afternoon, everybody. My story or journey starts on the 21st of December 2017. That date is burnt into my memory. That was the day I was diagnosed with mesothelioma. It was the day my doctor handed me a death sentence, although I thought, and confirmed by my oncologist with the words, "I give you months, not years, so you should get your house in order." But let's go back. Let's go back where this all started. Let's go back to January of 1971, the day I started my apprenticeship as a fitter and machinist at the State Electricity Commission, or commonly known as the SEC. I completed that apprenticeship in January of 1975. And yes, I did come into contact with asbestos during those 4 years, working across the 4 older power stations that no longer exist. It was just part of the job. On completing my apprenticeship, I left the SEC and went looking for further industrial experience. In 1979, I drifted back to the SEC and things had changed. Asbestos had now become the dirty word of industry. And they were frantically removing as much asbestos as they could. Are we still here? Yeah, as much asbestos as they could with very little safety gear. And when the sun was setting, it would shine through the windows of the power station and you could see the very, very fine dust floating in the air that we were breathing. After 22 months, I moved on. I couldn't see myself working in that environment for the next 30 or 40 years. At that time, the state government was setting up a new organisation called Technical and Further Education, or commonly known as TAFE. I applied for a teaching position to teach young apprentices the trade of fitting and machining, and I was successful. And I spent the next 32 years teaching across the TAFE system until finally in December of 2012, I was made redundant. And because I was only a month away from my 60th birthday, I decided to become a self-funded retiree. My wife, Karen, retired a few years later, and everything was going along nicely. 2017, about mid-year, I started to become short of breath, which is unusual for me because I have always been a fitness, healthy sort of person. October of that same year, I woke up one morning with minor chest pain. I told Karen, and of course straight away she ordered me off to the doctors. I told the doc what my symptoms were, and straight away he organised blood tests and a chest x-ray. The very next day, I get a phone call from the medical centre saying that my doctor wanted to see me right away. I got in to see him that afternoon, and he told me that the chest x-ray had shown a shadow on my right lung. And straight away he ordered a CT scan for me. I made an appointment to get the results of that scan, and the scan showed that that shadow was actually fluid on my right lung. So then my doc made an appointment for me to have a small amount of that fluid removed and sent away for testing. Now you've got to realise that all this has taken time. I made an appointment to go back and get the results of that fluid, and the appointment date was the 21st of November 2017. The day my world came crashing down. My doctor made an appointment for me to go and see an oncologist, and he spoke with me for about 20 minutes. I don't remember much of that discussion, except, as I said earlier, I'll give you months, not years. He went on to say that he couldn't do much with the cancer cells until the fluid had been removed, and that he would organise a thoracic surgeon to get in touch with me. It was a Saturday night, around 7:30, and I get a phone call from a thoracic surgeon, whose name was Associate Professor Cliff Chung. And he told me that he had made a booking at the Valley Private Hospital for me to report to them on Tuesday afternoon at 2 o'clock, and that surgery would be 8 o'clock Wednesday morning. Well, 8 o'clock Wednesday morning, they wheeled me in a surgery. That day was pretty much a dead loss. I don't remember much about that. But the next day I was speaking with Karen, and she told me that she had spoken with Cliff just after the surgery, and Cliff told her that if I had waited much longer to get treated, I probably wouldn't have made it. During the initial surgery, they removed 3.5 litres of fluid from my lung, and over the next 4 days, they drained a further 2 litres from my lung. So yes, I was a pretty sick puppy. I was in hospital for 10 days, and I was discharged on the 23rd of December 2017, just in time for Christmas. That Christmas was probably one of the best Christmases I've had with my families, because we didn't know whether it would be my last Christmas or not. 4th of January 2018, I had my first chemo session. I had 6 sessions. Each session was 3 weeks apart, and each session lasted between 5.5 and 6 hours. After my 3rd session, I had a CT scan, the results of that scan came back and said that my cancer cells had gone from 41 millimetres in length to 24 millimetres in length. Not a bad outcome. I had 3 more sessions, and after my 6th session, another CT scan was ordered. The results of that scan came back and basically said that my cancer cells were virtually non-existent. Now, don't get me wrong, I still have cancer, even though I am in remission. But I know that one day, not today and not tomorrow, but one day I will succumb to this. Because there is no cure. Since that CT scan, 3 years have passed. I have seen 4 Christmases, 4 Easters, and 4 birthdays we didn't think I'd ever see. During this time, Karen and I have had outstanding help and assistance from Vicky Hamilton, who you've met, and her team at Guards. And we would like to thank her for her help, her understanding, her support, and her friendliness. During my journey, I have come to appreciate a number of things, and they're just 3 that I'd like to share with you. Number 1, there is always somebody worse off than me. Number 2, listen to what your body is telling you, because it knows best. And 3, live for your moments, because you can run out of them before you know it. Over this last 3 years, I have surrounded myself with positive people, positive family, positive friends, and most importantly, a positive and loving wife, who over this last 3 years has been my rock. And without her, I don't know where I would have been. So, having surrounded myself with positive people, life is good. Thank you.
Thank you so much, Brian. If the students are anything like me, I think I need my box of tissues. But I just wanted to ask, that was a wonderful narrative, your story, it's so inspiring. But I believe you've just come back from holidays. So where did you go to?
My travel director will explain all that.
We've just spent 3 weeks in Tasmania, so just travelling around. It's like a second home, so we've been there quite often, but just to give Brian a break every now and then.
Yeah.
And with the holidays now, because of Brian's not deterioration, but there are changes, and chemo obviously had a great impact on his body, but we've just got to take things a bit slower. Brian's coordination and balance is affected, and sometimes his memory. So yeah, so we just got to take things a little bit slower and spend a bit more time with places where we've always been. Always been the type of people to just go, and but it was a nice trip. It really was.
Lovely. And I guess with COVID, you would have felt a little bit trapped for a while. So you'd be relieved to be able to get out and do some travelling again now?
Yeah, it was we still had to do the permits and make sure everything was right to go. And we're very much a factor of Brian wearing a face mask. We wear face masks, and it's not so much the abnormal now. Nobody sort of stares at Brian to say, "Why have you got a face mask on?"
I was wearing face masks before face masks became popular.
Yeah.
Just as a precautionary thing. The lockdown that we went through, that long period, it was probably the best thing for me because with the lung problem, I can't afford to get any kind of chest infection. So the lockdown was really good. I only ever, for about probably 4 weeks, the only person I ever spoke to was Karen. And you hear a lot about marriages breaking and falling apart. Well, ours brought us closer together.
Yeah, it's a lovely story. The students are all saying thank you. I don't know whether you can see in chat, but some lovely messages coming through there. Brian, do you have time, or Karen, do you have time to answer any questions?
Yeah, look, please feel free to ask us. We're quite open to it. You may feel that you feel that we're distressed or we're by it, but we're quite comfortable talking about it. And our philosophy is the more you talk about it, the more it can help other people. It helps us. Brian has had professional counselling as well, especially with the shock of having chemo and the diagnosis and that. And I felt it was important that he had help besides talking to me, so it wasn't all on me. My background too for people is that I spent 40 years in management in retail working for Woolworths. So I've had quite a bit of exposure to different situations. But again, personally, from my point of view, I thought Brian needed to talk to someone independent, and I could talk to them as well. And that can be organised through your GP. So there's a lot of things going on that people don't know about, and it does take a while to go through the processes. The system is not as straightforward. And everybody's case is different because everybody is different. But yeah, please ask us. We're quite.
Yeah, so Amanda said, it's very important for the students to hear about the long-term impact of these illnesses, and I think that that when the doctor said to you, "I give you months, not years," I think that's very important for our students to think about the language that they use with their patients. That those kind of things are so memorable and obviously have stayed in your mind for all these years, because that's what you heard. So very important, students, when you go out, to think about the language that you use with patients. So are there any other questions? Or if you don't want to verbalise them, you could pop, there you go. Here's a question Michael's asked. Could you please expand on what was most helpful in coping with your diagnosis, Brian?
What was most helpful? Excuse me. The thing about being diagnosed, on that particular date, I was on my own. Karen and her cousin had taken off to Japan. So I was on my own for nearly a month. And for 10 days, I never told anybody. Because I wanted her to be the first one to know. So it was the longest 10 days of my life. And I had 5 sisters, I had 4 remaining sisters. And I went up to see my sister, not actually to tell her, but I just couldn't help. She picked it. She asked me a couple of times what was wrong. So I broke down and told her, and after we'd spoken for about half an hour, I felt much, much better, as though the weight of the world had come off my shoulders. So to deal with it, talking to the people closest to you first, and then talk to anybody who really wants to listen to what you've got to say, because it's debriefing that helps a lot, you know? And that's why I do this sort of thing, because the more I talk about it, the more you guys start to understand a bit more, and the better I feel. So yeah.
Thanks, Brian. I think Amanda had her hand up and she'd like to ask a question.
Thanks for talking to us, both Brian and Karen. Obviously, you've both spent quite a bit of time trying to navigate the healthcare system at large through all of this. Have you got any advice for us as doctors as to how we can help our patients in the future, people like yourselves, to navigate the system better, to make that less stressful on you as a patient?
Yeah, firstly, as Brian says, it's more advisable to have someone with you. It's just that unfortunately our circumstances that Brian was by himself. But yeah, it's a shock and devastating when you get any diagnosis, but it's best to have someone there with you. Also, the fact is that keep going back to those appointments with them, and some people, a lot of older people do not like to talk about things, so that makes it very hard to get that information. And from a doctor's point of view, also ask what kind of background, where they worked, because asbestos doesn't only relate into the power industry, it's in schools, it's in all buildings that were everywhere. So getting to know that person's background and what their work environment would help. It makes it hard too, because doctors are now under pressure to only see you for one thing. So, you know, and you can't build a rapport with your doctor. We've been very lucky in a country, in a rural, well, I shouldn't say rural, but we're in a city, that we had a doctor for 5 years before he moved on. And now I have a young doctor who's just taken over Brian's case for the last 2 years. But it made it easier for me having a lot of things in place. But that doesn't happen in family situations when you've got older generation. So it's understanding the situation and also doing a bit of background on the different situations. Brian's actual terminology for his diagnosis is that he has asbestos-related pleural mesothelioma, which means it's in the lung lining. And of course, everybody likes to go to Google and find out diagnoses and things. And for me, my advice is don't go anywhere near there. You need to be more specific. So it would help as young doctors to do a bit of background and know what you're dealing with.
No, also, get your networks in place.
Yes.
What helped me a lot was my doctor did everything for me. He organised appointments, he organised people to call me, he organised pretty much everything. So when you get out there, get your networks in place. So if you get a situation where you've got a terminal, they don't really have to do a lot because they've got something else on their mind. They're worrying about, I'm going to die, and when am I going to die? So it's up to you to help them.
Thanks, Brian and Karen. Are you okay to keep going for a little bit longer?
Yeah,
yep.
It's emotional.
Yep. So yeah, and it's absolutely understandable. I think, Natasha, you had a question?
Hi. First of all, thank you for sharing your story with us. I just wanted to know what sort of, I guess, treatments you're on now, or if there's any sort of treatments long term.
I'm lucky. No, I was only on a couple of tablets during my chemo, and once I came off the chemo, nothing. I just went back to my normal meds that I was on before all this started, and I am still on just my normal meds. There's nothing that I'm taking in relation to to the cancer. So, and I put this down to I caught it early.
Early diagnosis.
Yeah, I caught it early because, as I said, I'm a fitness person. I'm even out now walking and pushing weights and all that sort of stuff. And when I started to realise that something was wrong, my body was telling me something. I didn't know what, but it was telling me something. And I caught it early, and that's why I think I must also thank my oncologist at the time for selecting the right chemo treatment for me, because catching it early and giving me the right chemo treatment knocked those cells on the head really well. So I just hang around until something changes, and keep doing what I'm doing until something changes.
So with Brian at the moment, because he's classed as terminal, he has a CT scan every 4 months, and we see an oncologist and the thoracic surgeon at the same time. And any changes, Brian either has the option of having more chemo. It depends on pain level, whether he'll have radiotherapy, and also whether he can have immunotherapy. So we have some options where before, with his diagnosis, we didn't have any options, but thankfully with the way treatments are going nowadays in clinical trials, there's more options.
And that's why I say get your networks in place when you get out there. Yeah. Anything else? No?
May I ask a question?
Oh, sure.
Thank you so much for sharing today. It's clearly very emotional for everybody listening. I know that I'm local to Gippsland, and that the power stations have provided jobs for lots of families and still do. And at the time, you know, I wonder, as you were starting to realise that mesothelioma was becoming sort of rampant in community of people who had worked at the power stations, had it been on your mind that you might succumb to it as well? And also, do you have friends that you've worked with who have also been affected?
Okay, I'll answer the second part first. At this stage, no, I don't. The people that I've worked with, it's funny you should ask that question, because I have three very, very close friends who we went to tech school together as young kids. We started our apprenticeship in the same trade on the same day. We worked in exactly the same environments, and I was the one that got it. Okay, so I don't know anybody just yet. The first part of your question, something that I don't even know if Margaret knows, but I was a first aid instructor for Red Cross for something like 24 years. So not only did I teach first aid, I did first aid, I was a sports trainer for 26 years. So I've got a little bit of medical background. And part of the first aid, there is a very, very, very small section in the first aid manual related to lung diseases. And it mentions a few, pneumonia, what's the other one? Pneumonia, anyway, doesn't matter. And one of them was asbestos. So dealing with that, I would say to my students that I work in an environment where I was surrounded by asbestos. And I'd say to my students, one day I could succumb to this. And I told my students that for many, many years, each first aid class that I did, that yes, I was aware of, I wasn't aware of the situation then, but as time went by and you learn more and more about asbestos, I started to realise that, yes, I stand a very good chance of succumbing, praying to God that I never did until the 21st of November, 17. Yes, I was aware of it. It was still a shock when I was told, but as soon as my doctor said to me, "You have mesothelioma," I knew exactly what that was. And I've seen, when I was a young apprentice, I had seen 2 people die from that. So we're going back to the late 1970s, early 1980s when these guys passed away, when it was pretty much determined that you smoked, so it was related to smoking. But I still remember those 2 guys, and that was at the back of my mind when I was told that I am going to end up like that. Well, 3 years later, I'm still here. Yeah.
And we're really inspired by that, and we want to see you again next year too, Brian and Karen. We want you to come back and talk to next year's cohort. There is another question here. Akshay's asked about community services and other help or support groups, and how that helps in coping with the diagnosis and treatment.
Well, so for guards, the only reason we sort of knew about guards is because where we live, their office was just around the corner, and we drove past it and walked past it many, many times until I was diagnosed. And then one day, Karen said, "Why don't we go in and have a talk?" So that's the main one. The others,
we were fortunate enough, with Brian's general plan when he was first diagnosed, so this is talking from the oncologist who'd done a general plan. Basically for Brian's general plan, it was to do his chemo and then be in touch with palliative care, and Brian's choice of whether he wanted to be at home or in hospital. So thankfully we didn't have to use that option, but it was there available. I'm very grateful to the Cancer Centre at Churchill Hospital, Gippsland Cancer Centre. I can't fault the nursing staff. They did go out of their way. They do have social workers there as well as part of the orientation when you go through chemo and things like that. So those community factors are more available now than what they used to be years ago. There is the local cancer support network too, but again, we're not in a situation where we've had to use it, but I know others have. So it's a case of, most of it now is directed back through your GP. Even the oncologist and that sort of tend to say, well, you know, work it all through your GP, your doctor. So the community health centre services have been good too. So yeah, it's a case of using what network you can, and hopefully your doctor or your GP is on board with those things. So as young upcoming doctors, yes, it's important to do a bit of research, or general knowledge would help too. So yeah.
And I think, Karen, that I know Vicky did a lot of work in helping to get that cancer centre up and running, because prior to that it meant that anyone with mesothelioma or lung cancer had to actually travel to Melbourne for treatment. So
yeah, well that centre was actually diagnosed to go to Frankston, and Vicky and that fought for us to get it here. And actually it was in the Herald Sun the other day too, which is great because it's something I'm all sort of into with immunotherapy, and that as an option is that we're in conjunction with the Alfred, they're going to start clinical trials up at Latrobe Regional Hospital for cancers, rare cancers and that. So yeah, it's taken a long time, but we're slowly getting there. Yeah, which is good.
All right. Well, if there aren't any more questions, I'm just aware that, you know, we've been talking for a while now, Brian, and I know that you've given up your afternoon from the support group because that's why Vicky couldn't be here in person, and we do thank you for giving up that that support group to come and talk to the students. So we just want to thank you both so very much and wish you all the best. And we'll
before we go, Mark, just one more thing.
Yeah.
they've asked me questions. I'd like to ask you guys a question. When you graduate and you have a patient come into your office who is terminal, how are you going to tell them that they're going to die? I don't want you to answer it. I just want you to think about it. Okay, that's my thought for the day.
And it's such an important question, and certainly over the course of the year, you know, we do talk about those kind of, you know, the way that people convey that message or ask that question or provide that outcome. But I'm sure, Brian, you've given students a lot to think about. I know that they've been thrilled to meet you both, and yeah, we just want to wish you all the best. And like I said, we'll see you in 2022.
Yes.
We definitely hope to be
yes,
there.
we'll be there.
Yeah. Nice to meet you all, and good luck.
Good luck with your studies.
All the best.
Thank you. Thank you.
Thank you so much.